All right, this is your new catheter. It's called ViaValve. When you take it out of the package, you're just going to hold the gripper and the sheath and pull straight off. You don't have to twist or turn. This needle's a nice sharp needle. It's a V-point, makes an incision cut. So in the beginning, I kind of tell you guys to go low and slow until you get used to that sharpness. The smaller gauges, the 20 through the 24s, you're going to get a quick flash here in your needle, and it still will fill to your flash chamber back here as well. This IV catheter has a push tab that's behind the color hub. You're used to threading here on the push tab, but just remember your new push tab is now behind the color hub of each catheter. The push tab will control the catheter movement. The gripper pad will control the needle movement. So when you pull that back and it clicks, it's going to be locked away in this housing. The also nice thing too is that the push tab's a bevel indicator. The bevel's always going to be up with that push tab. When you go to stick the patient, I do recommend either keeping your fingers to the side here or actually putting your finger up on that push tab and pulling back to make sure your catheter is fully seated. This one is ready out of the package. It does not require you to rotate it at all, so you do not need to do that anymore. So if you put your finger up here and pull back, you can always make sure that that catheter is fully seated before you stick the patient. So we're going to just kind of demonstrate on this dry vein pad, but when you go in, again, you can go on a nice low angle. You don't have to take a really high angle unless you're going for a very deep vein. But when you go in the real world, if I had blood in the vein pad, I would see a quick flash here. Whenever I see that, I want to stop advancing. I want to drop my angle to skin level, and then I want to advance it just a hair more to make sure both my needle and catheters are seated. Every catheter has a trim length, so where the needle and the catheter, they're always set back off of each other. So when we get such a quick flash in that needle and the smaller gauges, sometimes all that means is that the tip of that needle's in and not the catheter. So when I see that, again, when I see my flash, I'm going to stop, drop, that'll pick that bevel off that back wall, and just advance it a hair more, and now I'm ready to thread. I'm going to keep my fingers stationary here with the gripper pad, and now I'm going to use a push tab. If I'm two-handed, I'm going to come from the side and just advance that catheter. If I'm one-handed, I'm just going to advance it with my index finger until it reaches the hub or to the desired location. Once I finish, I'm going to leave my finger there. I do not need to push a button, so just leave it in place. And then with the other two fingers, you're just pulling that needle out, but you're pulling it until you hear that click. Once it's clicked, you can come up here then and just push down and disconnect, or use your other hand, and it comes right off. There's no twisting or turning with this one. Oh, I don't have it clean. When you hook up your extension set, there's now a valve in this hub, so it's going to hold back all that blood. So when you go to hook up your extension, just pull your spin collar back so the nose is fully exposed, and then you can hold the hub, usually where the sutures are, you can get a good traction, and then once you push in with your extension set, that valve is now open. Once it's open, it'll always be open, and then I can kind of tighten that down. And then if you hold the stem and the spin collar, you can even tighten it more if you need to. And now your valve is open.